Hello, aspirants. So as you know, we'll be starting the quiz at 10 p.m. 4 minutes to go. last 3 minutes to join the quiz. Alright guys, so 1 minute to go. To join the quiz, you can scan the QR code or go to our house line and put in the code. That is your R45FQ. We'll be starting the quiz shortly. Guys, we would love to hear your feedback. So do let us know how do you like the quiz and how is it going for you? How is the preparation as well? And if you guys need any help or something, you can always let us know. We'll help you out. All right. So it's time for some action. So it's 10:10. Let's get started. Yeah. Let's see. All right, guys. So welcome to JuxtaMed Quiz Show. Today we have anesthesia and it's the grand finale for tonight. So I hope everyone is ready. We have 20 questions prepared all for you. So let's get started. All right, so your first question is, which of the following medications should be stopped for 2 to 48 hours prior to the first use, which is usually used or what to do to Let's see if we can get this right. Let's move on. Okay. All right, guys. So hello to everyone. It's okay. Moving on to next question. Which of the following medications should be stopped prior to surgery for a patient with diabetes mellitus? Long-acting insulin, oral hypoglycemic agents, beta blockers, or short-acting insulin? Guys, if you're raising your hand, then okay, you guys are quick. Let's see if you know this. All right, so most of you have got this right. That is OHGAs, which is the right answer. Moving on. All right, so remember there's no negative marking. You can always answer what you feel is the answer and go back to the notes too. Okay, so your third question is, which of the following medications should be stopped prior to surgery for a patient with a history of hypertension? So is it thiazide? Is it ACE inhibitors, beta blockers, calcium channel blockers? Which hypertensive medication should be stopped prior to surgery for a person who has a history of hypertension? Let's see if you can get this right. Keep your focus. The last 10 seconds to go. Wonderfully done. Now let's see. All right, so most of you have got this right. That is ACE inhibitors. Nice. Now we have the longest streak person, that is Dr. Reed Stark. And then we have Ram, then Sriraj, Naga, Myra, Shanpriyan, Faizi, Krishna, Sundar, PP, Sai, LV, then Sharanya, Ramakrishna, PKSM, S, Hemant, CK, Soumya, RK, Aditi. All right, so you guys are doing great. Okay, let's keep one question and one time. Okay, so moving on to your fourth question, that is, which of the following statement about the management of hypoglycemia during the pre-operative assessment is true? The assessments are: skip oral hypoglycemic agents and insulin on the day of the surgery, or increase the dose of SGLT2 inhibitors prior to surgery to prevent hypoglycemia, or maintain target glucose level of 180 to 220 mm by DL pre-operatively. And your fourth assessment is continue long-acting insulin at full dose of the day of surgery. And you guys have answered. So let's see if you have answered it right. All right. So we have most of you putting the right answer. That is, skip hypoglycemic agents and insulin on the day of surgery. Guys, remember, each time you're solving the question, sometimes the questions can be related. I know you can't go back right now, but read the question properly. You might be able to get what the question is. All right, so tables keep turning. Now we have Sriraj who's leading as well as holding the longest streak. Then we have Naga, Myra, Dr. Reed, Krishna, Faizi, Ram, Sundar, PP, Sai, Shanpriya. All right, guys, you're doing great. Hemant. So your fifth question is, what are the precautions for a patient on anticoagulants before surgery? You only stop anticoagulants if bleeding occurs, or continue all anticoagulants without change, or stop low-dose aspirin 3 days prior to surgery, or no need to stop any herbal medications before surgery. So let's see, what is your doctor's opinion? What are the precautions for a patient on anticoagulants before surgery? What do you do for a surgery who's a patient on anticoagulants? Last 5 seconds. All right, so time is up. Let's see. Wonderfully done. So most of you have answered this right. That is stop low dose aspirin 3 days prior to surgery. All right, guys, you're doing great. Let's move on to your sixth question. That is, what is the recommended time frame to stop SGLT2 inhibitors before surgery to prevent euglycemic ketoacidosis? Is it 12 hours prior to surgery? Okay, you guys have come prepared. That is quick. Good one. 24 hours prior to surgery. That is right. Okay, so there's a division between you guys, but the right answer is 24 hours prior to surgery. All right. So, all right, guys. So I think every one of you have picked up the pace. People who are watching us on YouTube, guys, you can always scan the QR code and join the quiz. Moving on to your seventh question. That is, what is the target glucose level for patients with diabetes mellitus on the day of surgery? 80 to 120, 120 to 200, more than 250, or 100 to 140? What should be the target glucose level for patients with diabetes mellitus on the day of surgery? Okay. 120 to 200. I know you guys must have got this thing, but it is 120. Okay. So, nicely done, guys. Nicely done. Let's move on to your eighth question. That is, which of the following medication should be stopped 3 to 4 weeks prior to surgery in patients on MAO inhibitors? Statins, synthetic opioids, ACE inhibitors, or beta blockers? We are asking you which of the following should be stopped 3 to 4 weeks prior to surgery in a patient on MAO inhibitors. Anyone knows what is the MAO mechanism? If you know, great. Just let us know in the comment section. Okay. That is right. Synthetic opioids is the right answer. Great. Moving on to the leaderboard. You guys are doing great. Everyone has picked up the pace. Let's keep the pace up. Okay. To your ninth question, that is, what is the recommended fasting guideline for adults prior to anesthesia? 8 to 10 hours, 6 to 8 hours, 2 hours, 12 hours. What is the recommended fasting guidelines for adults prior to anesthesia? Let's see. You should have answered this quick. Is it tricky? Numbers are getting tricky. No, they are not, probably. Let's see. Right, that is 6 to 8 hours. You can't ask the patient to be starving for 12 hours. Okay. All right, guys, you're doing great. Sriraj is holding the longest string as well as on the leading the top leaderboard as well. Then we have PP, Dr. Reed Stark, then Sundar, Sai, Ram, Myra, Faizi, Hemant, Ramakrishna, S, Aditi, Naga, Shanpriya, Soumya, LV, Krishna, Aisha, CK, Dr. R, okay, Sharanya, Thor, PKSM, and RK. All right, guys, you're doing great. We have reached the mid of the grand finale. So, congrats. And let's see your question, that is, what is the main concern regarding the administration of ACE inhibitors and ARBs in a patient with hypertension prior to surgery? They need to be continued without any precautions, or they may cause severe hypotension during surgery, or they should be replaced with blood pressure medication, or they are safe to use as long as the patient is stable. Let's get back to the question. The question is, what is the main concern regarding the administration of ACE inhibitors and ARBs in a patient with hypertension prior to surgery? All right. Great going, guys. Great going. That is right. They may cause severe hypertension during surgery. Wonderfully done. Okay. So let's keep moving forward faster like you guys are. So your next question is, a 30-year-old man was brought to ER in an unconscious state after having collapsed in a railway station. As there was no pulse, CPR resuscitation was started and the monitor showed asystole. What is the next step in the management? Let's see, what do you do? Okay, the third option is missing one. So 1 gram of epinephrine. All right, that is right. Okay, okay. So that's great, guys. At least you know that you're doing great. Cool. Great going, guys. Great going. Let's keep up the pace. Now, the question is, which sensory fibers are least susceptible to hypoxia? Let's see if you can get this one right. I hope you remember that they have a time frame of few seconds, like milliseconds, and that is how they are differentiated as much to their susceptibility. Let's see if you can get this one right. Okay, I'll give you a correlation to this if you didn't remember. What do you do in starting CPR? What do you check for first? That is your answer. I mean, relatively the answer. Okay. B is the right answer. That doesn't set right, but okay. So your next question is, the patient undergoing surgery in the prone position is maintained on mechanical ventilation with PEEP. What is the significance of using PEEP in this scenario? All right, so you guys have answered. That is great. Nice. So most of you have got this right. That is prevents alveolar collapse and electrolysis of lung. Wonderfully done. I'm not showing you the leaderboard because I want you all to be curious who is going to be the winner. So your question is, which of the following agents is appropriate for reversing meconium when renal function tests are normal? Great, guys. So you've answered this right. Let's see. That is right. So gamma dex is the right answer. Moving on to your 15th question. That is, at what pressure does the valve open? Easy peasy, I suppose. Alright, so guys, let's reveal the answer. That is right, 30 to 45. What is this valve called? What is this structure part of? Anyone? Okay. Alright, so your next question is, what is the mechanism of action of the puree group of muscle relaxant? Uh, okay, great guys, great. That is right, competitively blocking the binding of acetylcholine to its receptors. Okay. Okay, so which of the following nerves is popularly used in clinical anesthesia to monitor neuromuscular blockade? Is it median nerve, ulnar nerve, or radial nerve, or mandibular nerve? Let's see. That is right. Ulnar nerve is the right answer. Moving on. Okay. Identify the Mallampati class of this patient. Let's see if you can get this one right. I hope you know how many classes are there. And then which one does this picture belong to? Okay, that's great. Class 2. Nice. All right, your second last question. Identify the Mallampati class of this patient. If you could guess the previous one, you can guess this one also. Think. Oh, wonderfully done. Oof. All right, that is right. Class 3. All right, so tonight the last question is identify the Mallampati class of this patient. Wonderful. So drum rolls for all of you. As you guys have been doing great. That is class 4. Wonderfully done, guys. Wonderfully done. So let's go. What do we have here? Is Sriraj, who has won tonight's quiz on anesthesia grand finale. Congratulations, Sriraj. Then we have Dr. Thor Reed Stark. Congratulations to you as well. Then Dr. Ramakrishna, congratulations. And you guys have done great, all of you. Faizi, Myra, Sundar, Sai, S, PP, Hemant, Soumya, Aditi, Aisha, Naga, Krishna, Sharanya, RK, Shanpriya, LV, Dr. Raj, Ram, PKSM, Thor, CK. So guys, it's congratulations to all of you. And tomorrow we have a radio grand finale. So be prepared with that too. And this is all for you guys. So keep your focus. You'll get through this. And it was a great session. Please let us know your feedback. We are very much happy to hear it. And if you guys need any help as well. So good night and see you tomorrow at exactly 10 p.m.